Welcome back, everyone. Now, Cat Scratch Fever was the title of a Ted Nugent studio album from 1977. However, it also refers to an actual real medical condition in pets as well as in people. Our pet vet, Dr. David Visser, joins us now without his electric guitar or his electric bass to give us some more insight. Good morning, Dr. Visser. What is Cat Scratch Fever?
Well, first of all, Ted Nugent's going to be here at Bluegate Theater in Goshen.
Okay, so
that's this week. And so
quick promo.
all year long, I've been wanting to wait and do this segment during that week that he was going to be here. It's a sellout, so you won't get a
stranglehold on your calendar.
Gotcha. Well, cat scratch fever is a significant condition, and it's also called cat scratch disease. That's really what the official name is. And it's due to a bacteria. It's called Bartonella henselae. It doesn't matter what it's called, but it's a bacterial condition, and it's really transmitted by cats with a scratch, but they have had fleas, and fleas actually have the droppings or the flea poop, if you will, but that gets under the nails as cats are scratching themselves. And then when they scratch a person, then that actually allows the bacteria to get into their body. And so this is a real significant condition in people, and we'll talk about how it affects pets as well.
Yeah, so what exactly is it? And it sounds like it could be something similar to an abscess, but that's not quite it.
Yeah, not the case. When cats get abscesses, of course, they can have an entire pus pocket. This is actually more significant of a condition in people because the bacteria that gets transmitted to people, if they're susceptible, and they actually are more susceptible than cats are, but when cats get this, that bacteria actually reaches the bloodstream and causes some issues. So, as I said, the fleas are the source of it, not really the cat. It's not that the cat is an infectious agent, but rather what they have underneath their claws. And so when they scratch a person, that bacteria gets access to the body and can cause infection.
Okay, so like you were saying, this can affect people as well, right?
Yeah, and so cat scratch disease is really more commonly a human condition than it is a cat condition.
Oh, really?
And the reason that we're talking about it is because cats, of course, can be the source. But cat scratch disease, when it affects people, the bacteria get into their bloodstream, and if you have a poor immune system, that's when it's actually the most significant of conditions. But most of the time, it develops after a scratch. There's a little red spot that develops at that spot. It's called a papule. If it continues beyond that skin area, then it can reach the lymph nodes and cause those lymph nodes to actually be swollen. Those swollen, painful lymph nodes from a hand standpoint might be the ones in the armpit. And for most people, this condition just spontaneously resolves. But if you have a poor immune system, you're on chemotherapy, a human immunodeficiency virus, something like this, then you will be more susceptible. And in those situations, the bacteria can actually reach the internal organs. It can cause heart valve disorders, failure of the internal organs, and of course it can be fatal. So this is one of the reasons why this condition is important to talk about in people, but as well how it is sourced from pets.
Yeah, so what's the likelihood that a cat that you come in contact with is carrying cat scratch fever? So
fleas is the number one thing, but where fleas are prevalent, there's dry parts of the country where fleas may not be as prevalent, but we are in river valleys, and it's certainly a lot of humidity as we're experiencing today, and that's perfect for fleas to multiply. And in areas where fleas are multiplying, it is said that up to 40% of those fleas can carry this, or 40% of the cats that have fleas in that area can do that. So it is fairly common for this bacteria to be present.
So can cats actually get sick from this?
Yeah, there's some debate about, for decades, whether they could actually get a disease from this or whether they were just carriers and it's really people that were the most susceptible. But we do know that cats can get a myriad of chronic diseases where it's not clear what organism within that chronic disease actually is playing the big role and which is the coat-tail organism playing on with this. But we know that some cats will get mouth disease if they have FIV or the feline immunodeficiency virus, or if their immune system isn't up to par. It's just not really the most common thing to point to when cats have that condition.
Okay, so how about dogs? Because they can also come in contact with cats pretty often as well.
Technically, they can be affected and infected, but they also don't have the sharp claws, so they're not going to be the ones to spread this condition very easily. But if they have fleas, they certainly can have the bacteria in their environment. They just don't tend to harbor it as much, and they don't really get commonly infected the way that cats might, and certainly humans.
Right. So are there tests or treatments for this?
This is debatable about whether you should screen your cat. There are tests that are available, but they're really low yield. And so testing as a preventative tool is not really advisable. If a cat or a person is suspected of having this, there are specific tests, but they are not 100% diagnostic either. You need to talk with your physician, of course, if you've had a scratch from a cat, and if you have signs like we talked about. And the testing should be done for people. But in cats, we're not really testing for that condition as a screen.
Yeah. So this is leading me to believe that prevention is probably the best way to go then, right?
Yeah, so people who have immunocompromised conditions should figure the pluses and minuses of living with a cat. Of course, we all know the health benefits of living with a cat, but we also know what they can bring in. So make sure preventing exposure is part of that possibility. Flea control clearly is the #1 thing. And of course, if you do have a flea infestation that you work your way through, cleaning the claws is really an important thing. An important part that people might think about is declawing, and that is not only an ethical dilemma, but it is something that should not be done to manage this condition. It's not part of prevention at all.
All right, good things to know. Thanks so much, Dr. Visser.
You're welcome.
Appreciate it. And if you want to contact the pet vet, you can reach him at Center for Animal Health by calling 888-PETS-VETS, or you can always shoot him an email at michianaPetVet@comcast.net. We'll be right back with more 16 News Now Saturday morning.